In high definition, this is News Channel 5, where the news comes first.
When we think of hospital gowns, we think of the ones that don't close enough in the back. But there is actually a new type of gown that's helping hospital infection rates. And as News Channel 5's Kay Quinn shows us, this breakthrough in medicine will remind you of one of the oldest and most popular hair dryers around.
Yes, ma'am.
It's got the flexible hose with the lock and release system and even the soft plastic lining that inflates to help disperse the heat. But this isn't a soft bonnet hair dryer. It's the Bair Paws system, the latest in infection fighting operating room technology.
It's wonderful. It doesn't get too hot. It stays about the same temperature, but if you want it, you can turn it up. This is part of it here.
82-year-old Edith Brown was put in one the minute she arrived for her recent vascular surgery on her leg. Every single patient who has an operation at St. Anthony's Medical Center is treated the same way. The goal? To keep their body temperature at 97 degrees, a reading of normal from pre-op to post-op.
Our infection rates have definitely gone down over the past year.
Studies also prove warming patients has lowered the risk of heart attack after surgery. Time spent in the ICU even shortened hospital stays. It works by keeping more than the patients relaxed.
When they're cold, their blood vessels will constrict. And when that happens, it actually causes the tissues to get harder, and then they are less pliable or receptive to the antibiotics.
The warming gown is actually part of a kit that includes a hat and warm socks for every patient, and the cost per patient is about $10.
At least as comparable as the money spent to launder the many blankets that used to be used to try to keep patients warm.
You blow up a balloon, that's the way it goes, up until it gets high enough and then stops. But it's wonderful. Oh, girl, I wish I could have invented it. I tell you, I'd be rich.
But as she's wheeled into surgery wearing her Bair Paws, Brown will settle for getting back on her feet as soon as possible.
Some studies show maintaining normal body temperature in all surgical patients even reduces hospital costs by $2,500 to $7,000 per patient.